Hello, and welcome to our podcast discussing service animals and their connection to One Health. My name is Bailey Roberts, and I'm speaking to you today alongside Hope Emmett, Sophia Radin, and Gavin Arnold. Let's begin with an introduction to the concept of One Health. One Health is an interdisciplinary approach to public health that recognizes the close connection between human health, animal health, and the environment. Rather than viewing these areas separately, One Health emphasizes that they function as an interconnected system, where changes in one domain can directly affect the others. This perspective has become increasingly important as global challenges such as emerging disease, environmental change, and urbanization highlight how shared spaces influence overall well-being. Organizations like the Center for Disease Control and Prevention stress that protecting human health requires attention to animal populations and environmental conditions. The One Health model encourages collaboration among physicians, veterinarians, environmental scientists, and public health professionals to develop more comprehensive and preventative solutions. While often associated with infectious disease control, One Health also applies to mental health, chronic conditions, and the therapeutic benefits of human-animal interactions. Service animals provide a clear example of how interconnected approach in action. Their partnerships with humans demonstrate how animal care, medical science, and public policy intersect to improve well-being. As research continues to expand, service animals represent one of the most innovative and compelling applications to the One Health framework today. In introducing service animals, though, we should first define what they are and their role within society. Service animals are specifically trained animals, most commonly dogs, that perform task-based work for individuals with disabilities. Their role is not simply companionship. Instead, they are trained to carry out specific tasks that directly affect somebody with a disability in their everyday life. This could include helping with mobility, alerting them to danger, or providing medical alerts. Because of their trained and functional role, service animals are protected under the ADA. This legal protection allows for them to accompany their handler in everyday places. Service animals support people with a wide range of disabilities. For individuals with physical disabilities, service animals can help grab objects, lead or guide them through the environment, and even assist with balance. They are also trained to support individuals with sensory disabilities like deafness or blindness. They help people navigate new spaces and alert them to environmental cues. All of these benefits directly link to the connection between animals and human health, highlighting the One Health approach. Humans also care for and support their service animals, showcasing the reciprocal effects of One Health, with humans benefiting animal health. Additionally, for people living with psychiatric or neurological conditions, service animals can alert the handler to changes in mood or psychological responses. They are vital in avoiding panic attacks or depressive episodes for many people. One major myth about service animals is that they are only for individuals with obvious or visual disabilities. In reality, many disabilities are invisible. Service animals are trained to help with every single type of task that the handler needs. Another common misconception is confusing service animals with emotional support animals. Unlike emotional support animals, which provide comfort through companionship, service animals are trained to perform tasks that they directly relate to a disability. Overall, service animals play a critical role in health in helping individuals with disabilities. They allow their handlers to have more independence, increase safety, and quality of life. Understanding what service animals are and how they help can provide great awareness, respect, and inclusion in our community, and is vital for their integration.
Thank you, Bailey. My name is Hope, and I'll be talking about the practical roles and impact of service animals. Let's discuss some of the practical roles of service animals in supporting human health. As mentioned already, service animals are task-trained animals that help mitigate a person's disability. That's different from emotional support animals, which can provide comfort but aren't trained to perform specific tasks, something researchers like Dr. Tiffany Howell make really clear. In terms of everyday function, service animals can be life-changing. They help with things like mobility, navigation, balance, and picking up objects, which increases independence and safety and reduces how much someone has to rely on caregivers. They also play a huge role in psychiatric and neurological support. Service animals can interrupt panic attacks or dissociation, provide grounding, or apply deep pressure therapy. This is especially impactful for people living with PTSD, anxiety, or other psychiatric disabilities. Beyond physical tasks, there are big emotional and psychological impacts. Studies show that people partnered with service animals often experience less anxiety and depression, less loneliness, and more emotional stability and routine. According to Dr. Janet Hoy Gerlach, these partnerships can really improve motivation and daily structure. There's even a psychological effect. Interacting with animals has been linked to increased oxytocin, which promotes calm and bonding and lowers cortisol, the body's main stress hormone. Even brief interactions can reduce stress. So, overall, service animals do way more than just complete tasks. They support independence, emotional regulation, and quality of life, helping people feel more confident and engaged in their daily lives. Sophia is going to discuss current research on service animals further.
In regards to the current state of service animals within the world, service animals play a critical but often misunderstood in public and One Health discussions. Under the American with Disabilities Act, or ADA, service animals are defined as dogs that are individually trained to do work and perform tasks for people with disabilities. This is important because not all pets qualify as service animals. They must be specifically trained to perform tasks directly related to the person's disability, such as guiding someone who is blind, alerting someone with diabetes to blood sugar changes, or interrupting one's panic attacks. From a legal and public health standpoint, the ADA ensures that individuals with disabilities can bring their service animals into public spaces. This isn't just about accommodation, it's about accessibility, safety, and psychological well-being. Service animals help reduce barriers to participate in education, employment, healthcare, and community life. Research supports these benefits. Rodriguez, Bibo, and O'Hare found that service dogs improve psychological health and overall well-being for individuals with physical disabilities or chronic conditions. Their study highlights benefits such as an increased social participation, reduced stress, and greater independence. These improvements extend beyond individual well-being. They influence public health by supporting inclusion, reducing isolation, and potentially decreasing reliance on certain healthcare services. More recently, research led by Dr. Carrie Rodriguez at the University of Arizona found that service animals can reduce the severity of PTSD symptoms in veterans. These dogs are trained to perform tasks like calming anxiety, interrupting panic episodes, and creating a sense of physical safety in public environments. When veterans experience improved mental health, this doesn't just benefit them individually, it strengthens families, workplaces, and communities. This is where the One Health perspective becomes especially relevant. Additionally, recent scholarships have explored broader societal outcomes. A 2024 review in Frontiers in Veterinary Science from the same Dr. Rodriguez as a second ago reported that individuals partnered with service dogs experience increased community engagement, perceived social support, which are protective factors against long-term mental and physical health decline. Researchers argue that these outcomes contribute not only to individual well-being, but also community resilience, an important pillar of One Health, which recognizes the interconnected health of humans, animals, and environments. In understanding One Health related to service animals, though we must also consider the needs of service animals themselves. Service animals aren't just tools, they're living beings with their own health and welfare needs. Their training, veterinary care, and working conditions must be ethically managed. At the same time, their presence can influence community health systems by improving accessibility and mental health outcomes. Recognizing service animals within One Health framework means considering both the human benefits and the well-being of the animals themselves. This growing recognition has been extremely important in securing ethical conditions for all service animals, especially within the United States. However, there are still some research gaps, which will now be discussed by Gavin.
Thank you, Sophia. Continuing on, I'll be talking about the current research gaps in the use of service animals for supporting individuals with disabilities. Firstly, on reviewing the current research landscape, it becomes apparent that a large gap is primarily present in relation to the quantity of research in the long term currently available. While many important studies have already been conducted, with a few of them already being discussed by Sophia, they often use small cohorts that make it somewhat difficult to draw broad, statistically significant conclusions. Without large-scale longitudinal research, it's challenging to fully understand the long-term outcomes of service animals or to influence systemic level policy. In response to this limitation, more structured and interdisciplinary research efforts are beginning to emerge. As service animals become more integrated into healthcare systems as well as disability support, collaborations between medical researchers, veterinarians, behavioral health scientists, public health experts, and many other groups are increasing. This interdisciplinary expansion reflects the One Health model directly, as long-term research is becoming more feasible when human healthcare, animal training, environmental contexts, and more are all studied together rather than separately. Strengthening these collaborations increases the likelihood of producing relevant data that is beneficial both to the humans and to the animals. Beyond the research itself, though, there's also a practical knowledge gap. Workplaces, hospitals, and similar environments are often lacking clear guidance on how to integrate service animals without sacrificing productivity or creating other operational issues. Liability and workflow are somewhat of the two largest areas of confusion currently, as businesses are unsure how to integrate service animals in a legal and effective manner. Applied research and standardization of service animal management could help reduce these barriers long term. In response to this challenge, innovations in training are emerging. As reflected by Zhu et al. In 2025, virtual reality tools are actually now being used to simulate complex environments for trainers, potentially making high-quality service animal training more scalable and also more accessible. Understanding how humans and animals interact in different environments, as simulated in virtual reality, allows for more specific task training in multiple settings. This not only improves preparedness of service animals, but also generates data about environmental integration that can inform workplace and hospital policy. This directly connects to One Health principles as it acknowledges that human health outcomes depend on how animals are prepared to function together with humans in shared environments. By aligning training methods with real-world environmental conditions, both human accessibility and animal welfare is strengthened simultaneously. Another gap is visible, though, within the narrow range of disabilities currently researched. While guide dogs for visually impaired individuals are well studied, this does not usually generalize well to individuals with other types of disabilities, especially newer or more recently recognized conditions that may benefit significantly from service animals, as mentioned by Pearson Dreschel in 2023. For example, PTSD in service animals, which we discussed before already, is gaining attention, but the research base is still somewhat limited. Encouragingly, though, this narrow focus is beginning to shift. One of the most exciting developments is the expanding use of service animals for so-called invisible disabilities, particularly psychiatric conditions, as referenced by Singleton in 2023. Service animals are increasingly trained to support individuals with PTSD, anxiety disorders, epilepsy, autism, and more invisible conditions. This represents a significant shift in how disability support is conceptualized right now, beyond purely physical challenges. Expanding research across multiple disability categories is important to strengthen the health of the One Health framework, and it follows many One Health principles, as it broadens our understanding of how animal health, human health, and environmental interaction intersect. As psychiatric conditions are increasingly treated on par with other medical conditions, interdisciplinary research grows, ultimately increasing knowledge related to service animal effectiveness and ensuring that both human and animal well-being is optimized. Additionally, secondary benefit recognition is growing. Service animals are no longer considered valuable only when they perform trained tasks. They often enhance overall quality of life. They can reduce social isolation, improve confidence, increase physical activity, and foster emotional stability. Researchers are beginning to explore these holistic benefits more intentionally. This broader recognition addresses one of the field's central challenges, the limited understanding of the total societal effects of service animals. From a One Health perspective, these secondary benefits are critical. Increased physical activity strengthens environmental engagement, reduced isolation enhances community resilience, and improved mental health supports long-term public health outcomes. These interconnected improvements demonstrate how all parts of One Health function as a unified system rather than isolated components. Finally, service animal use is expanding globally. With progression in global health systems and economic development, other countries are recognizing and integrating service animals into disability support, signaling a broader international shift towards inclusive assistance model. This global expansion further reinforces the One Health model as human accessibility and animal health protections are increasingly prioritized worldwide. Overall, while research and implementation gaps remain, the field is evolving rapidly. Many of these solutions utilized reflect core One Health principles. By strengthening the integration between humans, animal, and the environment, these developments move toward the field toward a sustainable and evidence-based future. Thank you so much for tuning into our podcast. We're all thankful for you listening and hope that you learn more about service animals and their connection to One Health.